Diazepam, which is commonly known under the brand name Valium, is an anxiety-reducing, hypnotic, sedative and anticonvulsant drug used to treat a wide range of emotional and physical disorders. Diazepam belongs to a class of drugs known as benzodiazepines. Benzodiazepines are a class of psychoactive drugs that work by enhancing the action of the neurotransmitter gamma-aminobutyric acid. Benzodiazepines are used as a short-term treatment for a wide range of emotional disorders, and occasionally as a long-term treatment for certain physical disorders. They are one of the most widely prescribed medications in the United States and have almost entirely replaced other central nervous depressant drugs such as barbiturates. This is due to their less addictive nature and higher lethal doses. Diazepam is the most widely used benzodiazepine, however it is most commonly used as a short-term treatment to help with anxiety disorders. It works by depressing the central nervous system and slowing activity in the brain. When treating anxiety, it is commonly used alongside more long-term treatments and medications, such as SSRIs and cognitive behavioral therapy, to help reduce and manage anxiety symptoms. Diazepam can help reduce psychological symptoms of generalized anxiety, social phobia, panic disorders, or other anxiety disorders by enhancing the action of the neurotransmitters in the brain that produce feelings of tranquility. Diazepam is commonly used while more long-term treatments take effect. Some antidepressant and anti-anxiety drugs, such as SSRIs, are known to cause adverse physical and psychological effects in patients during the first few weeks of treatment. Diazepam and other benzodiazepines are commonly used during this period to reduce these effects. A previous study in 1964 studied the effectiveness of diazepam in 103 patients. Patients were initially treated with a starting dose of 5 mg, which was taken 3 times a day, with the daily dose eventually being adjusted to each patient with a range of 6 to 50 mg a day, which was taken in 3 to 8 doses. Results from diazepam therapy were judged to be good or excellent in 95% of the patients in relieving anxiety, tension, panic and depression, and also raised the emotional tone of patients. After a month of treatment, 60 of the 103 patients were switched to an identical placebo medication on a blind basis. After a month on the placebo drug, half of the patients' anxiety symptoms returned or worsened, 21 showed no change, and 9 showed similar benefits experienced from diazepam. The study found diazepam to be most effective at doses of 5 mg taken 3 times a day, with higher doses causing the patients to become more tranquil and less mentally alert. Diazepam showed to be most effective in patients between the ages of 40 and 60, with the majority quickly experiencing relief from anxiety, depression, and improved confidence and ability to work or improvement in personal relations. Another study from 1965 compared the effectiveness of diazepam and a placebo against propropamate, which was the best-selling minor tranquilizer with anxiolytic effects at the time of testing. The study monitored the effectiveness of each drug in relieving anxiety in a double-blind experiment involving 3 cases. In 2 of the 3 patients, diazepam was said to be the most effective in reducing anxiety symptoms. The 3rd patient showed no indication of drug preference. Although proven to be effective against anxiety, long-term treatment of diazepam is not recommended. This is due to its addictive nature. Unlike other central nervous depressants, diazepam is often obtained illegally and used recreationally to induce feelings of euphoria, a lack of coordination, and a feeling similar to that of being drunk. If not used correctly and used for an extended period of time, the brain can quickly become dependent on the effects provided by the drug. Diazepam is often used recreationally with other depressants such as alcohol, barbiturates, and other benzodiazepines. When combined with other drugs or alcohol, it can result in a potentially fatal overdose. Lasting effects of diazepam abuse can lead to depression, aggressive behavior, memory loss, psychotic experiences, and further drug abuse. Heavy and long-term use of diazepam can lead to serious withdrawal symptoms such as seizures, severe anxiety, insomnia, hallucinations, paranoia, delusions, poor concentrations, respiratory distress, or personality changes. Due to its addictiveness, non-addictive substitutes are often given to people with a history of drug or alcohol abuse. Alternatives often include sedative antihistamines such as promethazine hydrochloride or diethylhydramine hydrochloride. Another previous study from 1983 tested the clinical outcome of long-term diazepam treatment in 180 chronically anxious outpatients in a double-blind continuous study. Data from the experiment show that the majority of patients benefited from prolonged-release diazepam as opposed to regular diazepam tablets. Patients using prolonged-release diazepam also did not develop a tolerance to the drug during the 22-week study period. 5% of the patients treated using diazepam for less than 8 months showed no signs of withdrawal, whereas 43% of those treated for longer than 8 months showed clear signs of withdrawal. Those experiencing withdrawal symptoms from the drug showed obvious signs of distress, however they were not life-threatening nor did they cause any significant physical effect to the patients. In all of the cases that displayed withdrawal from the drug, the withdrawal symptoms could be managed by gradually reducing the dose of the drug. Abuse of diazepam and other benzodiazepines has become a more prevalent issue in both the US and the UK in the past 15 years. US hospital statistics show that admissions for both diazepam and other tranquilizer abuse increased by over 700% between 2003 and 2012. Diazepam is now the third most widely abused tranquilizer in the US after alprazolam. Cognitive behavioral therapy is a type of psychotherapy which involves trying to change the way a patient thinks and responds to situations and emotional triggers to try and combat certain mental health problems. Although it has proven to be effective in treating disorders such as obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, phobias, eating disorders, insomnia and drug or alcohol misuse, it is most commonly used in treating anxiety and depression. In cognitive behavioral therapy, problems are broken down into 5 main areas: situations, thoughts, emotions, physical feelings, and actions. CBT is based on the concept that all of these 5 areas are interconnected. It works to change negative patterns and improve the patient's state of mind by teaching new coping mechanisms to help combat mental health conditions. Unlike many other forms of psychotherapy, cognitive behavioral therapy aims to combat current problems as opposed to focusing on issues from the past that may have led to the disorder. When treating more severe cases of depression or anxiety, CBT is often used alongside antidepressant and anti-anxiety medications. CBT has proven to be as or more effective than antidepressants in treating anxiety and some forms of depression. CBT usually involves one-to-one sessions of talking therapy. Between 5 and 20 weekly or fortnightly sessions lasting between 30 minutes to 1 hour are usually given. During these sessions, the therapist will analyse the patient's thought patterns, emotions and behaviours. The patient's problems are also discussed and broken down. Coping mechanisms and different ways of looking at situations and controlling emotions are proposed to help alter the patient's day-to-day mindset. A previous study from 2018 monitored the effectiveness of cognitive behavioural therapy in decreasing anxiety levels in a 22-year-old female patient that was suffering from anxiety and had been diagnosed with arrhythmia. The patient suffered anxiety regarding social relationships, family problems, and romantic relationships. The patient stated that she felt like her friends were intentionally avoiding her and talking about her behind her back. The patient also stated that she struggled to meet new friends and to find a romantic partner. She had signed up to online dating platforms to meet new people, but had not yet been successful in finding a romantic partner. The patient is insecure after being single for about 6 months. She admits that she sometimes stalks her former boyfriend on the internet and has feelings of inadequacy because of his new partner. The patient also complains that she worries about her health condition. She mentions that she continuously worries about her healthiness and also reports she often has thoughts regarding her death. The treatment was conducted over 5 sessions over a span of 3 weeks, with each session lasting between 1.5 to 2 hours. All of these 5 sessions began with breathing relaxation. The first session aimed to identify the patient's negative thoughts and what effect these had on her behaviours. The second session aimed to teach rational responses to negative thoughts. The third session tried to modify the patient's negative behaviours to be more positive. In the fourth session, the therapist evaluated the development of positive thoughts and behaviours in the patient. In the fifth and final session, the therapist discusses with the patient how to maintain positive thinking and behaviour in the future. The importance of psychopharmacology is also discussed in the session before therapy is terminated. The change in anxiety levels were monitored before session 1, during session 3, and after session 5. The change in anxiety levels was monitored using the Hamilton Anxiety Rating Scale questionnaire. Before the treatment, the patient appeared jittery, nervous, with outbreaks of crying when discussing problems. She also complained about her fear of death due to her cardiovascular disease and mentioned that she had trouble sleeping because of this. The patient previously feared her friends were intentionally avoiding her and talking about her behind her back. The patient also mentioned that she would never find a romantic partner and feared being alone for the rest of her life. After the treatment, the patient appeared more relaxed and at ease. She was able to discuss previous issues and interact in sessions more calmly. The patient discussed making productive changes regarding to her cardiovascular disease instead of just worrying about it. She stated that her fear of death was just due to her negative thoughts. She claimed that she had been practicing breathing relaxation at home and that this had helped her with her issues surrounding sleep. The patient now realises that her negative thoughts surrounding her social relationships were due to her not spending much time with her friends and understands that there was no clear evidence of her friends talking behind her back. The patient realised that her fears regarding never being able to find a romantic partner was due to being too picky and shutting out possible opportunities. Overall, the results of the study showed that the anxiety level of the patient had decreased by 51% over the 5 sessions. The patient's previous score of 55 in the first session decreased by a total of 29% to a score of 39 in the third session, and decreased again to a score of 27 after the 5th and final session. This shows that CBT helped gradually decrease anxiety levels in the patient after each session. The results of the Hamilton Anxiety Rating Scale assessments showed that the anxiety levels experienced by the patient had decreased from very severe anxiety to moderate anxiety. Studies have shown that CBT is more effective in treating anxiety than medications such as SSRIs or benzodiazepines, with research indicating that a total of 60% of those who undergo CBT experience substantial improvements, whereas only around 50% show any sign of improvement from medications. Whilst research does claim that CBT is more effective, more research in this area is needed. As CBT is a talking therapy, side effects, dependence, and other factors associated with taking medications are not experienced. CBT also teaches patients skills and mechanisms to change their mindset for the future, whereas medications only usually provide short-term relief for the symptoms of the disorder.